Have you ever thought about how surgery could be done without a big incision? Well, today we're going to take a journey deep inside the human body, into the world of what's called endovascular therapy. This is a field where major surgery on our body's most critical plumbing, our arteries, is done through a puncture so small you could literally cover it with a Band-Aid. And to really get just how revolutionary that is, let's look at the before and after. I mean, just look at this comparison. It says everything. You've got the old way, open surgery, a huge incision. You're put completely under with general anesthesia, and you're looking at weeks, maybe longer, of recovery. And then you've got the endovascular approach. A tiny puncture, you might even be awake with just local anesthetic, and you're back on your feet so much faster. It's not just an improvement, it's a complete game changer in medicine. So, what's the big problem we're trying to solve here? It really all boils down to one thing: blocked arteries. Over the years, this stuff called atherosclerotic plaque can build up inside our body's arterial highways. You can think of it like rust or limescale, slowly clogging up a pipe, making that path for blood flow narrower and narrower and narrower. And here's the genius solution. Instead of cutting through all the layers of skin and muscle from the outside to get to the problem, doctors figured out a way to travel inside the blood vessel itself. It's incredible. They can now navigate the body's own plumbing to fix the problem right at the source. It is quite literally surgery from the inside out. Okay, so how do they do it? Well, every single one of these amazing procedures, no matter how complex, starts with the exact same crucial first step: getting access. Before you can use any of the cool high-tech tools, you have to get inside the arterial system safely and, most importantly, precisely. The main on-ramp to this whole arterial highway is usually an artery in the groin called the common femoral artery. Now, finding it isn't guesswork. Doctors use a combination of techniques. They feel for the pulse, they use ultrasound to see it in real time, and they use a type of live X-ray video called fluoroscopy. All of this lets them guide a needle into that specific artery with just incredible accuracy. And this whole process has a name. It's called the Seldinger technique, and it's just so elegant. So let's walk through it. First, the needle goes into the artery. Then, a super flexible little guide wire is threaded right through the needle. Then, the needle comes out, leaving just the wire behind. And for the final step, a small, hollow tube, they call it a sheath, slides right in over that wire. This sheath is now your portal, a secure little doorway where all the other tools are going to travel. All right, we're in. So now it's time to open up the toolkit. And the first, most fundamental tool we have to talk about is the humble but incredibly powerful balloon catheter. I mean, this little thing is really the foundation of this entire field. Balloon angioplasty. It's just a beautiful, simple idea. You take a catheter with a tiny, deflated balloon on its tip, guide it all the way through the arteries to the blockage, and once it's in the perfect spot, you inflate it. Now, it doesn't actually remove the plaque. What it does is forcefully squish it against the artery walls and stretch the vessel itself, cracking that plaque open and reopening the channel for blood to flow. So let's walk through it step by step. First, that catheter makes its way to the blockage. Second, the balloon gets inflated, usually with a special fluid so you can see it on the X-ray. Third, that plaque gets flattened against the artery wall. And fourth, the balloon is deflated and pulled out. What's left behind? A wider, clearer path for blood. For a lot of blockages, this is all you need. But there's a catch. What happens if the artery is kind of like a rubber band and just springs back to its narrow shape after the balloon is gone? Or what if sometimes the force creates a little tear in the artery wall that can actually block the flow? What do you do then? Well, you need something that can hold that artery open for good. And that is where stents come in. Just think of them as internal scaffolding. They're these tiny, expandable metal mesh tubes that are placed inside the artery, and they provide a permanent, rigid structure to make sure it stays wide open. Now, what's really cool is that not all stents are created equal. You basically have two main flavors. You've got balloon-expandable stents, which are rigid, usually made of steel, and they're deployed with a lot of force for precise placement. They're great for straight, stable arteries. But then you have self-expanding stents. These are made of a wild memory metal called nitinol. They're super flexible, and they spring open all on their own. They are perfect for arteries that have to bend and move, like the ones that run down your leg. So, we've got our balloons and our stents. A pretty great toolkit. But sometimes you run into blockages that are just next level tough. They're so hardened that you have to bring in the specialist tools. Yeah, the big problem is calcium. Some plaque isn't soft and mushy at all. Over time, it gets hardened with calcium deposits until it's basically turned into rock on the inside of your artery. A simple balloon just isn't going to cut it. It would just bounce right off. And that's when you call in the heavy hitters. You've got things like cutting balloons that have tiny little blades on them to score the plaque before you inflate it. You have atherectomy devices, which are basically miniature drills or shavers that physically grind away and remove the plaque. And then you've got drug-coated balloons, which do their work and then leave behind a medicine to stop the blockage from growing back. And just to give you an idea of the kind of power we're talking about here, look at this number. A rotational atherectomy device uses a tiny diamond-coated burr that spins at up to 200,000 RPMs. It literally sands the calcified plaque down into microscopic particles that are so small they can be safely carried away by your bloodstream. It's just incredible. And here's why those drug-coated balloons are such a big deal. This chart shows what happened in a major study. After 1 year, they checked to see how many arteries were still open. With a standard balloon, it was about 53%. Not bad. But with the drug-coated balloon, it was over 65%. Why? Because that drug helps prevent the kind of scar tissue that can cause the artery to narrow all over again. Okay, so the hard work is done. The artery is fixed, blood is flowing freely again, everything's great. But we're not quite done yet. There is one last absolutely critical step. You have to safely close that tiny little hole in the artery where this whole adventure started. Now, the old school way was pretty simple. Just press down on it really hard for about 15 or 20 minutes until a clot forms. And that works. But in the modern era, as you can imagine, we have much faster, much more sophisticated ways to seal that puncture site up. And there are two main strategies. On one side, you have devices that work from the outside. They deploy a tiny absorbable collagen plug that basically acts like a stopper you'd put in a bottle. Then on the other side, you have suture-based devices, which are even more clever. They actually deploy a tiny stitch from inside the vessel, essentially sewing the hole shut before the whole device is even removed. So when you put it all together, from the needle that gets you in, to the balloons and stents, to the device that seals the hole, the impact has been a complete paradigm shift. I mean, this quote from a medical textbook says it all. For so many of these diseases, these minimally invasive techniques are no longer just the alternative option. They have become the primary go-to treatment. And all of this leaves us with a really fascinating thought to end on. We've seen this journey from massive open incisions all the way down to these tiny Band-Aid-sized punctures. And as these incredible tools keep getting smaller and smarter and more precise, it really makes you wonder, right? How long is it until this kind of life-saving surgery might not require any incision at all?